So common issues that can come up are that your ads aren't bringing in enough caregivers or the right kind of caregivers. So putting that headline in there that grabs at their heartstrings, having your pay range in the headline and doing a pay range, not as straight, we pay 15 an hour. Our range is really helpful. And not hitting them with all the rules and regulations right at the beginning of the ad. Many times, most of the time, they don't read the whole ad. Most people don't read cover to cover, top to bottom, the whole ad. They read the first part and maybe some things that stand out. So really what they should be, you want to pull at their heartstrings, you want to let them know the pay range and tell them why they want to work for you. Not, we need this, we need that. If you don't have this, you can't be. Like none of that. It should all be, we pay weekly, we have vacation time, we have sick pay. We do free training, whatever those benefits are, those should be at the front of that ad because you're trying to get them to read what they will read and you want to get their attention and keep their focus. And if it's all like, you got to do your application first, or you have to have a fingerprint card first, those things are important, but those things can be handled after they're in front of you or you have some communication with them. You want to be able to, the idea of the ad is just to get them to respond. Not to hire them. It's just to get them to respond. So that's what you have to think about when you're making your caregiver ads. What can I say just to get them to call me, text me, come to me and apply? That is all the ad's purpose is. Sometimes you can't reach the applicants. I know like the voicemail is not set up. Their voicemail is full. They don't answer their phone. It can be really hard. Remember, many of them are already working and this is part-time or they're working for a couple of home care companies. So if they're with a client, they can't answer their phone. If they're at work, they can't answer their phone. So it can be very challenging to reach applicants. You can't get applicants scheduled for interviews. That can really be a challenge too. You're reaching out to them and they're just not getting scheduled. Applicants aren't showing up for their interviews. That can be super frustrating. You might have 10 people scheduled for interviews today and none of them show up. Why aren't they showing up? So we'll talk about that. Applicants aren't showing up for orientation. That's also very frustrating, or training, whatever, you're calling that there in your office. Very frustrating. And then this is, I think, one of the most painful things. You've done everything. You've interviewed them. You've done training. You're set. They're hired. They're caregivers. And now they're ghosting you after orientation. You just never hear from them again. So we're going to talk about all these common issues. I think I see some chats there.
Right. Yes. Anna Gaines from Heart of the Carolinas says she's the nursing director. And yes, it has been very difficult with recruiting nurses. Mm-hmm. And then Helena, I'm going to say Blanco from Passion Home Health said, yes, recruiting LPN, CNAs, and direct support staff is really hard.
It's really hard. And it can really keep you from growing your business because without your field staff, you can't grow. So this can be a bottleneck in your system. So let's talk about this and see what can be done to